Hi everyone, thanks for tuning in. Today I'm going to be talking about the importance of posture and mobility in mechanical neck pain. My name is Erica Cutspec. I'm a doctor of physical therapy at the Gananda Walworth location. I graduated from Ithaca College and I've been a practicing physical therapist since 2010 with Village Fitness since 2018. My areas of interest include sports and running related injuries, treating shoulder and knee pain, as well as resistance training throughout the lifespan. So what is mechanical neck pain? Mechanical neck pain is a general term referring to pain caused by placing an abnormal stress and strain on the joints and muscles of the vertebral column. It's important to note here that today I'm talking about just mechanical neck pain. I'm not talking about pain caused by disc herniation or any kind of nerve entrapments or radiating or radicular symptoms. Neck pain is very common. It occurs throughout the world and throughout the age span, and can cause substantial disability and increased economic costs if left untreated. Here's a quick just spinal column anatomy. So today we'll be talking about the effects on the cervical and the thoracic spine. So the purple area is your cervical spine at the top. The blue area where your mid-back is the thoracic spine. And then your lumbar spine is the yellow area down below. We'll be focusing on the purple and the blue areas. One of the biggest take-home points of my talk today is don't wait if you have neck or back pain. Usually these types of aches and pains are often neglected and put off until too late. This winds up turning a minor fixable ache into a potential chronic pain, along with other debilitating issues that may result. Seeing a physical therapist early during onset can help tremendously. So again, get it looked at now, call up your doctor, call up a physical therapist. Don't wait until later. Don't put it off. So what are some causes of mechanical neck pain? Usually mechanical neck pain arises insidiously or out of the blue and can be the result of multiple factors. Some of these factors include poor posture, decreased range of motion and strength, occupational or sporting activities, any type of strain or sprain, and also anxiety and depression can contribute to mechanical neck pain. We're going to be focusing on the first two today, talking a little bit about poor posture and how decreased range of motion and strength can be affected to kind of help with your mechanical neck pain. So posture. So when I talk to my patients about posture, I kind of like to reframe their thinking a little bit. I like to think that the ideal posture is a state of maintaining a balance in the body. So you're using the minimal amount of musculoskeletal activity without causing pain or discomfort. Posture is very dynamic. We're not statues. We're constantly moving and shifting in space. And we can't really promote an all or nothing approach when it comes to posture because it's not realistic. It really depends on what you're doing during the day and how you're moving. So therefore, there's really no best posture. And I'll kind of talk about what we should focus on instead. I have a lot of patients come to me and say, I know I have bad posture. I have trouble sitting up straight. I have trouble bending over correctly every time I lift something. And this is something, again, we're not expecting you to be statues. We're not expecting you to have perfect posture all the time. What we are kind of expecting is that the best posture is your next posture. So you're making sure to change the stimulus and you're constantly putting yourself in different positions. So you're not allowing your body to adapt to one specific position. You know, we'll discuss what reverse posture is. So basically, if you're in one position all day, you get up and do something in the opposite position to kind of maintain that balance. As long as you're moving, you're doing the best thing for your posture. So just being conscious that if you are sitting a lot during the day or you're working at a computer or you're bending over a lot, to do activities that in the opposite motion to kind of counteract the effects of that. So what contributes to some postural changes that happen in the body? So basically, it's the opposite of everything I just talked to. A sedentary lifestyle, decreased mobility, all of these things accompanied with prolonged positions can cause changes in the alignment in your spine. So some of these possible changes include a forward head posture, which we'll talk about, and thoracic kyphosis. And we all know we're frequently using our computers, we're on our phones more, you know, heads bent, forward kind of flex without breaks or changing positions. And that's kind of that sustained state, that sustained posture of one position is where we kind of get into trouble. So what's a forward head posture? So basically, it's an increased activation of your cervical extensors and an increased load on the erector spinae muscles to kind of adjust for the neck to balance. Continuous loading causes variations in the spine curve and eventually leads to degenerative changes. Some changes you might notice are decreased cervical and thoracic range of motion, some shortening of your neck and shoulder musculature, and then eventually some osteoporosis or a presence of a dowager's hump. So if you look at the picture on the right, you'll see kind of over time, the chin starts to kind of come forward. You start to notice increased curve in the cervical spine, and that's also of the thoracic spine. So some other symptoms of mechanical neck pain. Usually it's pain that gets worse with being in one position for a long period of time. Muscle tightness or spasms. Patients usually complain of pain between the shoulder blades, or they have muscle knots or restrictions. Frequent stiffness in the neck and the upper back, feels like you have to crack. And then also headaches can be one of the symptoms. How do we fix it? Again, come see a physical therapist. Don't wait. As soon as you start to kind of have pain or symptoms lasting more than a couple days, it's a good idea to get it checked out. Stay moving. Again, the best posture is your next posture. You want to be sure you're stretching shortened musculature, so doing passive stretches to kind of counteract those prolonged positions. And the last one is you want to mobilize your thoracic spine. So this is the new kid on the block. There's been good research to suggest that mobilizing the thoracic spine can help improve your cervical and thoracic range of motion, and also help to reduce your pain. So if you remember, the thoracic spine was that blue area on the spinal column anatomy slide. So it's more your mid-back. And these are some of the stretches on the right that a physical therapist can help you with. And they can kind of show you some movements to perform at home and to kind of aid with maintaining mobility and getting back some of maybe the motion that you have lost due to poor posture and sustained positioning. So how can we help? You can make an appointment to see a physical therapist and get moving. Again, don't wait. See us sooner rather than later. It's always easier to fix things when they just pop up. You can contact one of our offices, or you can email info@villagefit.com. You can visit our website and request an appointment. You do not need a prescription to attend physical therapy. Since 2006, New York State residents can see a physical therapist directly due to what's something called direct access. Basically means you do not need a physician's prescription. Direct access PT is covered by most insurance companies, and you can always check with us about limitations. This also allows a patient to be seen for 10 visits or 30 days, whichever occurs first, before a prescription is needed. So thank you guys for tuning in. And again, don't wait. If you're having back or neck pain, come see us. All right. Have a great weekend.